John, the implementation of the Affordable Care Act, also known as Obamacare, has been sluggish, inconsistent, and we are starting to hear about insurance premium rates for 2015, substantial increases coming, companies planning to stop providing health insurance to employees through large group plans. I think many think that they're safe, John. Is the ACA just a forerunner of a secondary goal of having the government being a single-payer plan for everyone? And Part B question, what do you think about these escalating rates that are going to start to be announced here in a few months?
You know, Jan, if we go back to some conversations we've had probably a couple of years ago as we look forward to this, to answer, I guess, the second question first, we talked about the fact that insurance premiums are based upon dollars received in versus premium dollars paid out to pay for expenses. The company keeps a small profit in that to be able to operate what they do. But one of the ways that insurance companies were able to manage their resources was the goal of insurance originally was to provide major medical care. It was designed to keep you from going bankrupt should you have a major catastrophic event in your life. Under the new system that we're under with this Affordable Care Act, it's basically become an everything insurance. And because of that, the more dollars that have to be paid out for everything from the sniffles to contraceptives to mental health, chiropractic, what all that may be covered under the individual plans that are there in these mandates that are astronomical in cost, the only way the insurance companies can survive and be able to stay in business is to increase the premiums so that they have enough dollars coming in to be able to pay the claims as they hit their door. Now, the problem with that, and one of the strategies that's been discussed by a number of different economists, is this a precursor to a single-payer system? There is already a system in place that in the event the insurance companies are unable to foot the bill, then guess what the relief is? It is the American taxpayer stepping in with a bailout from Uncle Sam to prop the insurance carriers up. And should that happen, would the next logical step be, we're going to help you, but if we're going to help you, we want to step in and have control over what you're doing. And from that began to move us to a single-payer system similar to what we see with the Medicare system.
You write about and talk about, and you've issued warnings to retirees. You've even issued warnings to some who may not be retired but who are aging a bit. You have told me privately, it's no secret, Medicare doctors are leaving in droves. Medicare reimbursements have been reduced. You cite an article that suggests that retired couples might spend as much as $200,000 on medical expenses in their retirement years. Retirees will face a lower standard of living due to increased health care costs. At the same time, the article that you sent me, young people will pay much, much more to help defer the costs for the old. And of course, this is just the opposite of what was being promised. And we don't have to revisit that because that's been on overdrive for a couple of years. But so what kind of advice do you have, say, for senior citizens?
Jan, when we look at the healthcare environment, I am deeply concerned, just as a citizen of this country, much less an economist, by the problems that we see coming down the pipe. To be able to fund some of the provisions of the Affordable Care Act, they have taken money from Medicare and reimbursements. We've seen doctors leave. Medicare Advantage, which is a program that many poor people have used to be able to subsidize what Medicare doesn't pay, that system has been attacked through the ACA, and dollars are there. I am deeply concerned, and there was an article that recently came out that was talking about a third of Americans may have to delay their retirement because of health care costs. Barring a significant change where this law is repealed, I am deeply concerned that the quality of care that we're going to continue to see in America is going to continue to decline. We're going to see rationing. We're going to see higher cost. I believe we may ultimately see a two-tiered system where those that have the dollars to pay for private care can get the private care that they need, and those that don't will get the limited resources that the government is able to provide. And that means the longevity that many of us looked for and were excited about in retirement within just a few short years may not be the exciting thing that we saw, because our advances in our country have been tremendous, and we survive what used to kill us. But if that innovation and that drive goes away and it becomes cost prohibitive and we don't have the dollars to pay for care, and this Affordable Care benefit package doesn't provide the dollars, we get sick and we die. That's where we are.